Try to explain here briefly about the effects of CO2 on the pulmonary vasculature and cerebral vasculature. So on the right side you can see the effect by the CO2 on the cerebral vasculature, and on the left side you can see on the pulmonary. So if you drop CO2 in the pulmonary vasculature, it has a vasodilatory effect. So what does it mean? It decreases the pulmonary vascular resistance and it increases the pulmonary blood flow, and that is one of the mainstay of treatment in a patient who has pulmonary hypertension, especially in pediatric cardiac ICU. And the reverse is true on the cerebral vasculature. Means if you drop CO2 in any patient, then you end up by having a vasoconstriction on cerebral blood flow. So you end up by having a decreased cerebral blood flow, and cerebral vascular resistance is increased, and that is one of the temporary measures you can take in a patient who has a raised ICP or traumatic brain injury. And the reverse is true. Suppose if you have a high CO2, it has a vasodilatory effect on the right side, which is cerebral vasculature, and if you have increased CO2, then it has effect in the form of more vasoconstrictive effect on the pulmonary blood flow. Means it will increase the pulmonary vascular resistance and decrease pulmonary blood flow, and which has a side effect on a patient with the high pulmonary pressures. So why it is important? So both diseases, pulmonary hypertension or traumatic brain injury with the increased ICP can be life-threatening in any patient in a pediatric ICU. So we can take advantage. So in a patient who has pulmonary hypertension, you can drop the CO2 and it has a vasodilatory effect, increasing the pulmonary blood flow by reducing the PVR. Although you have to adopt other measures of pulmonary hypertension like hyperoxygenation, IV milrinone, or you can give them inhaled nitric oxide, or even you can ventilate if they need to drop their CO2, so that you can get the beneficial effect of low CO2. And obviously if they if they survive the critical phase, then later on you can switch to phosphodiesterase inhibitor like sildenafil, which is phosphodiesterase inhibitor 5 oral. And in a patient who has a traumatic brain injury and they have a high ICP, temporary, definitely sometime, especially if you are going for any procedure, taking patient for the CT scan, any kind of imaging, or even to the for neurosurgical intervention at the bedside or in the operation theater, you can drop the CO2 like low 30s, and it will give you temporary, definitely it has an effect in these patients. You can prevent the coning and increase ICP effect on the brain temporarily, although you will adopt the measures like removing the cause which is causing the high ICP, or you can give mannitol or hypertonic saline. And obviously if patient has a high ICP, then you want to take airway and you want to sedate and paralyze the patient in most of cases. So, and also you have to remove the trigger which is causing high ICP spikes. So in a summary, it is very important physiologically that we need to understand, and we can remember these things, that CO2, if you decrease CO2, it has a vasoconstriction on the brain and vasodilatory effect on the pulmonary vasculature. And the reverse is true. Like if you increase CO2, it has vasodilatation in the cerebral blood flow, and in a case of pulmonary blood flow, it has a vasoconstrictive effect. So effect of CO2 on cerebral blood flow and pulmonary blood flow is opposite.